When it comes to filling prescriptions, it involves more than just labeling a bottle or counting pills. It's a very detailed process that involves more than most people would imagine. There are basically two different ways that prescriptions reach the pharmacy. One is in the form of a new prescription, and another is in the form of a refill request by the patient. The new prescriptions are most commonly electronically prescribed by the provider's office. They can be called in verbally by the provider or the provider's agent. They can be scanned or faxed into the pharmacy, as well as in our particular case with our corporation, we can hand deliver those through a courier service from our outlying sites directly to the pharmacy for filling. Once the prescriptions are received into the pharmacy, the inputting technician does a bit of triaging, so to speak. By working on the prescriptions in order of priority, patients who are waiting in the facility are given top priority, first in the filling queue, followed by prescriptions requested by patients wanting the drive-through service. We then work on those prescriptions received by the pharmacy for patients who are not there, then patients who have requested their prescriptions to be delivered to one of our 10 child sites the following day. The technician will enter all the information that is needed to fill the prescription, such as the drug strength, the directions, the refills, the day's supply, the doctor's name, and the original date written. At this time, the technician will review the patient's profile, looking to see if the medication is due based upon the last refill date. The technician will then bill the patient's insurance accordingly, whether it be Medicaid, Medicare, commercial insurance, Medicare Part D, usual and customary charges, or the sliding fee pricing program. We also work hard to address any third-party rejections as well, and if needed, we contact the third parties to request prior authorizations, refill too soon overrides, or we contact the doctor in cases if it's a medication that's too expensive on the insurance, to try to find something that's more economical that will work just as well for the patient. After all this is determined and the technician has put in all the necessary information, a label is then generated and a prescription can then be filled. Once a label is created, the order is placed into a color-coded tote indicating if the patient's waiting, or if they're in the drive-through, or if it needs delivered, or if they're coming back. At this stage in the filling process, the technician is responsible for reviewing the prescription information that the inputting technician entered for any obvious errors, retrieving the drug off the shelf, checking the NDC against the drug order to ensure that everything is correct. At the pharmacist verification station, all the work the technicians have done up to this point in preparing the prescription is checked for accuracy by the pharmacist. In addition, we then do a final verification that the patient has no existing allergies to this drug or one similar to it, and we determine whether or not there are any potential interactions of the patient's current medication with any existing medication they are taking, which, by the way, is very important for the patient to fill all their medications at one pharmacy. We take into consideration whether the dose is appropriate based upon the patient's age, gender, weight, and even whether or not they have any kidney or liver dysfunction. Once the prescription is verified and bagged by the pharmacist, it is placed into the will call bin for the patients who are picking up here on site, or it's placed into a holding area to be able to be processed for delivery. The cashier's main duties are to retrieve the filled prescriptions for the patients at the counter or the drive-through and cash them out.
Visit us at CRHPC.org.